Hello, and welcome back to How to Get Beyond Better to Feeling Your Best. My name is Ceciel Rooker. I'm the President and Executive Director for the International Foundation for Gastrointestinal Disorders, or IFFGD. IFFGD is a patient education and advocacy organization whose mission is to inform, assist, and support people with gastrointestinal disorders. With me today is one of IFFGD board members, Darren Brenner, who is also a gastroenterologist at Northwestern University. As you may have heard in our previous episodes, he is often known as the butts and guts guy at Northwestern. That's because he specializes in treating those of us that have gastrointestinal motility disorders. He also works with people with pelvic floor disorders. And these disorders can include constipation, fecal incontinence, irritable bowel syndrome, dyspepsia, gastroparesis, also the opioid-related bowel dysfunction disorders and there's several of those. He also works with the complications of systemic motility disorders with an emphasis on scleroderma. Many other GI conditions. He has a very full practice at Northwestern and a very busy schedule. So we are thrilled that he has taken time to join us this month for this program. Welcome, Dr. Brenner.
Thanks, Cecile. Happy to do it. Happy to be here.
As always, we really appreciate your time. For those of you at home, as you know, it's December. It's the end of the year. We're heading into the holidays, but also it's Constipation Awareness Month. And for those of us who suffer from constipation, it's important, right? So we're going to spend this month talking about constipation because it is important to talk about. In this particular series of Beyond Better, we are going to focus on constipation predominate irritable bowel syndrome. Over the last several weeks, we've talked about what it is. We've talked about the symptoms. We've talked about what to expect at your healthcare provider appointment as far as diagnostics and how do you get diagnosed. Today, we're really going to buckle down into treatment because treatment for us with constipation is very difficult, making sure that we're managing our symptoms so that we don't just feel better. I'm pooping more, but actually we're feeling our best and we can actually go to those holiday functions. We can actually get out with our family and our friends and do things during this holiday season of December and not be limited by our constipation predominant irritable bowel syndrome. So as some of you may know, I was diagnosed with constipation predominant irritable bowel syndrome in 1998. And when I was, my doctor told me that he was thrilled to tell me he had a diagnosis, but unfortunately, there was nothing he could do for me. There were no medications, there were no treatments, and I needed to learn how to self-manage. Wow, we've come a long way. Here we are in 2024, and we have options. So, Dr. Brenner, we're going to walk through all of those today. Let's start with the easiest for us as people that live just every day, going into the pharmacy or the grocery store, going to the digestive health aisle and looking at all those over-the-counter options. What's there for us?
So I hate to be the negative person to start this off, Cecile, like you said back then when they had nothing to offer you. But the reality of the situation is if you truly have irritable bowel syndrome, as we've mentioned in previous discussions on this website, the sine qua non of IBS is pain, discomfort, bloating, and distension. And unfortunately, none of the over-the-counter therapies that you can go into a store and buy have ever been shown to actually improve the abdominal symptoms. So if you're going to walk into a store and pick up a laxative or another therapeutic, I want you to know that your focus should be on improving your bowel symptoms. Go more frequently, softer stools, less straining, get more out. And yes, there are people out there that say if I poop more, I feel better, and that's okay. And that may be one reason to justify starting with the over-the-counters. Now you'll get to that part of the store and you will be just inundated with a glut of different things. And the question becomes, where do I start? And there are many different ways. There are osmotic laxatives, things that we call PEG 3350. There are stimulants, senna, bisacodyl, cascara. There are magnesium-containing compounds. There are enemas. There are suppositories. There are stool softeners. And my personal bias would be to start with the osmotics like the PEG 3350, followed by the stimulants. Now, you may get some kickback when you go to see your practitioner who says, You can't take these stimulants like Senna or bisacodyl forever. But the reality of the situation is that in standard doses, these are very safe for bowel symptoms and can be very effective. So I don't want you to be afraid of them. The ones I'd recommend staying away from are the stool softeners. They just don't have a biological mechanism to help you go to the bathroom. Those aren't ones I'd recommend. Enemas, more so suppositories. I like suppositories like bisacodyl suppositories every 3 days as a rescue, because we all know if we are used to having a bowel movement every day, and this is our standard, it's not everybody's standard, but if it's your standard, and you go 3, 4, 5 days without a bowel movement, you start to feel kind of poopy, right? And if you can use the suppository to get things out, those can be very beneficial. But if you truly have irritable bowel and you have abdominal symptoms, then the place to start is probably going to be with a prescription FDA-approved medication, because those are the only ones to date that have been validated to improve the global or the totality of IBS symptoms that people with this disorder experience.
Okay. Well, in that case, tell us about them.
Sure. So there are currently 4 FDA-approved therapeutics for treating irritable bowel syndrome with constipation. 3 come from a class of drugs known as secretagogues because they lead to secretion of fluid into the intestinal lumen, which softens stools and pushes things down. There's one called lubiprostone, another one called linaclotide, and the third plecanatide. They're variations on a theme. They have some subtle differences, which you'll want to discuss with your practitioner when you're thinking about using them. But at the end of the day, all have been shown to be effective for improving abdominal pain, discomfort, bloating, distension, frequency, texture, less straining. So they're very, very effective global therapeutics. The new kid on the block is a medication called tenapanor, which actually works on a sodium hydrogen exchanger. Instead of secreting fluid into the intestinal lumen, it actually retains fluid in the room in the lumen. That's the difference of secretagogue versus retainagogue. So it has some subtle differences and has a different mechanism whereby it improves pain. Again, all of these shown to be effective. Any one of these, from my standpoint, is a viable first option. What it really comes down to in 2024, we all know, is cost and coverage. If you can't afford it, we're not going to give it to you. If it's not covered by the insurance, we're probably going to move on to something else. So that still plays a major role in the process. But what I want you to know is that all these are very, very effective therapeutics, and they're all very, very safe. They have minimal systemic penetration, little to no drug-drug interactions. They don't get into your other organs, so they are really focusing on those IBS symptoms you're suffering from.
That is so good to know. So I have a question about these. So there's 4 of them, right? And 3 of them are in the same class. Does that mean that if you take one and it doesn't work, that you rule out the others? Or can you, if you're not feeling your best, if you're only feeling better, can you try a different one? Or is there help for that? I mean, is it help?
Yeah, you can certainly try therapeutics within the same class. Although they fall within the same sphere, there are subtle differences between these therapeutics that I think all of us as practitioners over time have found that anecdotally, if you fail one, you are potentially likely to respond to another. So I wouldn't say you have to initially leave the class, but some people are looking for different mechanisms of action. Some people are looking for different types of responses, and thus considering a therapeutic in another class would be absolutely fine as well.
Fantastic. So for those of you at home, if you are prescribed one of these medications by your provider, you go home and you take it, you go to the doctor's appointment and they're like, so are you feeling better? And you're like, I'm better. Make sure that you explain if you really feel like it's the best that you can do. And if you feel like there's still things in your quality of life, which Dr. Brenner has really handed on with us in every single one of these episodes, talking about those things that you're not able to do, make sure that you have those conversations, because there are options, 4 different options that you can try. And so that's great news. 1998, I had 0. So today I have 4. I'm really excited about that. And thank you for taking the time to explain that with us. But Dr. Brenner, there are a lot of people that don't want to take a medication. They don't want to take a pill every day. They want to do something that's more holistic, some holistic care. Complementary and integrative health is really kind of gaining popularity these days, especially in the GI illness community. What are some of those options for people with constipation, predominant irritable bowel syndrome?
Sure. Well, the one I think most people ask about is probiotics. Which probiotic can I take to help my constipation? And unfortunately, the reality in 2024, like 1998, is the answer is we don't know. We don't have enough evidence to support one probiotic versus another. So I'm not somebody who's in favor of these, and we actually don't recommend them as treatment for irritable bowel syndrome with constipation. But there are other options. There are some things out there like yoga. Yoga has been shown to be beneficial. Exercise alone has been shown to be subtype agnostic for irritable bowel syndrome, so it can help with constipation. There are vibrating capsules that are now FDA cleared that you can use that probably help more with the bowel symptoms than the abdominal symptoms. But I've had some patients come back and tell me that they've had improvement in their abdominal symptoms as well. Looking at some older things that people don't think about anymore, abdominal massage. There's some literature that supports doing abdominal massage. There's data, lots of data for acupuncture and acupressure. Now, granted, almost all of these trials come out of Southeast Asia, the vast majority from China, but there are studies showing that acupuncture and or acupressure could be effective as well. For really refractory patients, there are things like transanal irrigation, which you can consider a high volume colonic. I do not recommend those in most situations, and I recommend them with these medical devices as kind of last ditch efforts when everything else has failed. Again, some people with irritable bowel syndrome, like we mentioned last time, have overlapping pelvic floor dysfunction, and then pelvic floor physical therapy and biofeedback can be beneficial as well. And then last but not least, posture modifying devices. Things that change your position on the toilet can actually be beneficial for helping you have more regular and better bowel movements too. So there's lots out there for the person who comes in and says, I don't want to take a pill. What else have you got?
That is fantastic. I love having options, especially when it comes to treatments. And just to clarify, there's no reason why we can't do some of these things while taking a medication,
Of
right?
course, 100% there can be overlap and use of multiple modalities to improve symptom output.
Yeah, and I imagine that that probably is helpful, right? Like to layer the treatments on top of each other, to help you really get better.
I would recommend if you're going to layer, I am a fan of doing one thing at a time to see the response. Now, if you're doing one thing like adding a posture modifying device and a medication, then absolutely fine. But I don't like using over the counter, natural, holistic, and prescriptions at the same time, because if you don't have a response, then we know that both don't work. If you do have a response, I don't know which one's working for you, whether it's both, one or the other. So I've committed you to two therapeutics and the cost of that long term. If you have a side effect, I have absolutely no idea which one's causing the side effect. So I do like to do this in a graded manner, one at a time. But if it's something like yoga and exercise with a prescription or, using a posture modifying device, that's absolutely okay.
Fantastic. That's wonderful guidelines to keep in mind. So let's talk a little bit about some of the overlapping conditions with irritable bowel syndrome as a whole, not just constipation. Many people, when they are confined to their homes, they begin to find that they have some anxiety, stress, and these things can be really amplified and their irritable bowel syndrome symptoms, right? And so it's sort of something that can exacerbate their symptoms. Probably not, a call, not something that we want to say this is for IBS, but ways that people can really target those. I know that there's a lot out there that's been studied.
Yeah. So there are a lot of what we call brain gut behavioral therapies that can be effective. And we understand the cycle. Realize that, as you mentioned, Ceciel, it's not a cause of irritable bowel, but it can certainly be an exacerbator of the syndrome. Think about somebody who has bad constipation or IBS-C, bad pain, discomfort, bloating, distension. They're afraid to eat. They're not eating much. They're feeling uncomfortable. That leads to stress. And stress leads to fears and avoidance. I don't want to go out. What if I feel crummy? What if my friends wonder what's wrong with me? So they stay home. And they don't eat as much, and eating is a trigger to go into the bathroom. So they eat less, so they have less bowel movements, which makes their symptoms even worse, which exacerbates the stress. And you can see this cycle. And this is a place where brain gut behavioral therapies can start to break that cycle. And there are some very good ones out there. Mindful meditation, but most people will use cognitive behavioral therapy or gut directed hypnosis. There are therapists out there. There are websites. So, for example, the Rome Foundation has a website of people who specialize on this. But there are also now digital apps, digital therapeutics that have been validated validated in clinical trials, and they're out there for cognitive behavioral therapy. There's one called Mahana, or gut-directed hypnosis, which is Regulora or Nerva. And you can do these at home on your phone or on your iPad, or if you want to, flash it up on your screen, on your TV. And these take about 10, 15, 20 minutes a day and have been shown to very effectively alleviate some of the symptoms of irritable bowel syndrome with constipation.
Fantastic. Thank you for sharing those. And again, perfectly fine to do those with the treatments that we have
Absolutely.
discussed.
Mhm.
Wonderful. All right. So we have to talk about food. Now you just mentioned it and what happens, right? People
Yep.
eating hurts. And so they don't want to eat. They eat certain things, they hurt worse. So then they don't eat. And then the constipation gets worse because there's nothing for them to poop out. People really will tell me, what can I eat? That's their question. And if we can solve that, everything will be good in their life. So obviously we can't completely solve that mystery. There's a lot of research going on about diet, nutrition. However, what are some tips that you can give people, some talking points about food and diet and as a therapy for irritable bowel syndrome?
Sure. Let's start with
With
something that's very
constipation
common.
specifically. Yeah.
Absolutely. So people come in and the first thing they ask is, do I have food allergies or food sensitivities? And the first thing we have to do is differentiate between the two. Allergies are a hypersensitivity reaction, and this may be a little bit too much of basic biology, but it's what we call an IgG-mediated disorder. For the folks at home, what that means is you eat something, and think about, you may know kids with peanut allergies. They get hives, they get itching, they get constriction of their lungs, they start to wheeze, get shortness of breath, increased heart rates, palpitations. These are people that need to carry around EpiPens. These are true allergies, which are different than sensitivities, which sensitivities are, I eat foods and I feel kind of crummy, okay? There are blood tests out there that purport that they can test for these sensitivities. They don't. You don't want them. There's one that's being trialed right now, looking at 18 common foods that may be more consistent with irritable bowel syndrome with constipation. Discussion for another time, but we are looking into those sorts of things. So if your primary care comes in and says, there's this test out there, it looks at your IgGs, you can test all your sensitivities, what tells you what you shouldn't eat. Don't believe that right now. It's not yet ready for prime time, okay? So that's the allergy sensitivity debate. When it comes to foods to avoid in individuals who have irritable bowel syndrome with constipation or even chronic constipation, from a population level standpoint, there are no particular foods that have been shown to trigger these types of disorders. But there are foods that have been shown to be effective. Kiwis, mangoes, prunes, chia or flax seeds, oatmeals, the types of fibrous foods that I've been talking about, or even fiber supplements like psyllium has been shown to be very effective. Unlike insoluble fibers like wheat or wheat bran, which a lot of people think can be effective, but there's really no data to support them. So when people talk to me about IBS-C and constipation, I say there's some foods that could potentially help, but I can't tell you in 2024 which foods are actually going to hurt you. And everybody's different. Your microbiota, your microbiome, your metabolome is different from the person next to you. So a lot of times I say, keep a food diary. Help me figure out what's bothering you. And then maybe I can break this into different classes of foods to avoid, and we can go down that route. Now, somebody comes in and says, everything I eat makes me feel bad, then it's probably more the process or the food. We know. We've done surveys with people with irritable bowel syndrome. Almost 90% of people who've been surveyed say they think food is a trigger, and the gastroenterologists agree with them. And something that we all agree on is the best way to get better is to have these individuals see an expert dietitian. This is going to be beneficial, and I know that we have some resources for the patients out there on their behalf.
Absolutely. And as a matter of fact, IFFGD has been cultivating a list of these dietitians, and they're actually called GI dietitians because they have been specially trained to work with people who have gastrointestinal disorders and would like to talk to a dietitian about those disorders and food in relation to those disorders. So if you would like to learn more and find a dietitian, feel free to check out our IFFGD dietitian listing. It is on our website. If you are unable to find that, then please email us at iffgd@iffgd.org, and we'd be happy to work with you to find someone, especially if you can't find someone on our list that's in your area. We might be able to find someone that can do telehealth. So like you said, working with a dietitian is really important. And that food diary it's key. And IFFGD actually does have some blank food diary forms in our resources, and you're welcome to use that. But let's talk a little bit about what that food diary might entail, Dr. Brenner. So let's say I don't want to download something off the website. I'm just going to grab a piece of paper. I'm going to write a pen. I'm going to put a note on my phone. What are the key things that I should be keeping in this diary that's going to make it beneficial?
Yeah, so you want to, again, try to identify key foods. So on the days where you don't have symptoms, there's no real reason to keep the diary. And you want to do it probably right after a meal. So if you notice you feel poorly after a meal, log what you're experiencing. And we'll try to look, like I said, for trends or different classes of foods. We know from trials in patients with irritable bowel syndrome that the most common triggers are things like galacto-oligosaccharides or fructans, garlic, onions, wheat. A lot of people think that they're gluten sensitive, but they're actually fructan sensitive because a piece of bread contains insoluble fibers, which can make symptoms worse, gluten, which is a protein, which can make symptoms worse, and fructans, which are highly fermentable carbohydrates. And in clinical trials, it's more the fructans than it is the gluten. So these are the types of things we want to see. It may also be important to give us an idea of the portions. How much are you consuming? Because in many cases, it's not an all or nothing process. You may come in and say, I eat 7 grapes and I feel horrible, but I eat 2 and I feel fine. In that case, it's more about the amount than the actual food itself. And that's something a really good dietitian can tease out. So if you have your creature comforts, if you have the things you love to eat, you may not have to completely give them up. It may just be like we always say, everything in moderation.
Absolutely. And that is another key, right, to getting your life back and having that great quality of life and knowing that you don't have to sacrifice the things that you love. We have so many people that just cut so much out of their diet for fear of the pain, and it's real. It's so real that that pain is debilitating. But working with a GI dietitian, looking at some of these other treatment options in connection with that, some of those behavioral options, the yoga, exercise, and even over-the-counter and prescription medications in conjunction with looking at a diet with a GI dietitian can really give you a well-rounded treatment plan so that you can get the most out of your life. Right.
I think you hit on the point. I mean, as we close this last session on Constipation Month and IBS-C, that is the key, right? Interdisciplinary care is key to improving symptoms in irritable bowel syndrome. Using the behavioral, the dietary, and the biological pieces are all effective. And we know that if we integrate these together, the outcomes are better and the costs are less.
That is so true. And of course, remembering that we have this whole toolbox that Dr. Brenner has given us. If something doesn't work, then you can always talk to your healthcare provider about something else, right? So if you're going in and your doctor is saying, so last week we talked about looking at your food, you said you were going to start exercising, and we tried this prescription, and you say, I feel better. But if that's not your best, if you're still missing out on life, then you need to say, how do we get even better? What else can we try? Because there's so much here that you can try. And always ask those questions, have open and frank discussions. And as Dr. Brenner says, always let them know how this is affecting your life, because that is so important. So I think that that really is a fantastic way to end our program here, Dr. Brenner. Thank you so much. I love how you were able to walk us through all things constipation, predominant irritable bowel syndrome with a lens on that healthcare provider visit. And how do you communicate effectively, talk about diagnosis, and talk about these treatment options, and also how to talk about your symptoms. All those things are so important. At home, I hope that you have enjoyed this program. We have spent this entire month of December trying to educate you on how to get beyond better to feeling your best if you have constipation predominant irritable bowel syndrome. Many, many thanks to you, Dr. Brenner, for taking time out of your busy schedule to be with us for this program, flying in from cross country to jump right in front of the camera to videotape these with me. We really appreciate you here, and all of us at IFFGD appreciate your dedication. Thank you.
It's my pleasure. And again, just to iterate what you said, we want you living your best lives. So if you're getting some improvement, but you think that there's more improvement, let us know. Quantify your improvement. Okay. If somebody walks in the office and says, I have 20% improvement, I've got room to move. I need to know that. So let us know about it. We're here to help.
Absolutely. Let's all get beyond better. All of us. Let's get to living our best life. Really make that a focus for yourself during this holiday season as you see things. All of us that have IBS-C have missed out on things in life. All of us have. Remember to get that to motivate you to really and truly see if we can move that needle forward in your life. So thank you so much for watching. I really hope that you've gotten something out of this program, that maybe you've gotten some pearls that you can take back to the healthcare provider visit to help you feel your best. In addition to this program, as I've mentioned before, IFFGD has a ton of resources on our website. We mentioned earlier in this episode the dietitian listing, which is available. We also have two websites specific to constipation and IBS. One is aboutibs.org, and the other is aboutconstipation.org. These are two of the many websites we have as a foundation. We also have a resource library that has a numerous amount of fact sheets, including some of those daily diaries that we discussed in this episode. There's an entire fact sheet just on pharmacological treatments for irritable bowel syndrome that was written by Dr. Brenner with us today, that really gives you a lot of detail and pros and cons and ins and outs of all these medications, more than we could possibly spend in the short amount of time we have today. So please check out all of these resources. If you still need help, email us. Email us at iffgd@iffgd.org. We are here for you. As a foundation, it's one of our missions. Our goals is to help you and assist you. If you have questions, you have needs, let us know. We'll see what we can do to help and help you to navigate this journey. That is chronic, it is lifelong, but it doesn't mean it has to be the end of the journey. This is just the beginning of us getting better, feeling our best, and really, truly living our best life. Thank you so much for being with us this month. We hope that you've enjoyed your time with Dr. Brenner and you've enjoyed these conversations. And from all of us here at IFFGD, we just wish you the best coming up in 2025. Thank you for watching.